Hi class. Today we're going to pick up with stress testing. We're on page 392 in your text. Here's our little joke of the day. My doctor says I need to take a stress test. I thought sitting in his waiting room surrounded by coughing children for 2 hours was the stress test. Can anybody relate? Okay, so let's start out by talking about the absolute contraindications for a stress test. Last lecture, we ended with talking about the indications for a stress test. However, today we're going to talk about the absolute contraindications for a stress test. This means these people absolutely cannot, should not be getting a stress test, okay? Somebody who's had an acute MI less than 48 hours old, someone who has uncontrolled symptomatic heart failure, unstable angina, symptomatic severe aortic stenosis, dissecting aneurysm, or acute pulmonary embolism. Now, these patients, these are relative contraindications in which the doctor will weigh the benefit versus the risk, and so they may be scheduled a stress test, and they may not. It depends on the doctor's discretion and all of their other comorbidities and stuff like that that's going on with the patient. So it'll be more like on an individual basis. So these patients are the ones that have left main coronary artery stenosis, any mental or physical issues that renders the patient unable to exercise adequately, uncontrolled tachyarrhythmias or bradyarrhythmias, severe hypertension, high degree AV blocks, such as your second or third degree blocks, electrolyte abnormalities, moderate stenotic heart valve disease, and hypertrophic cardiomyopathy. So how does the patient prepare for the stress test? First of all, your single most important piece of equipment for your stress test is going to be your 12-lead EKG machine, okay? You're going to secure the leads on that patient. You may even have to tape them if necessary. Women are encouraged to wear a bra in order to decrease the artifact. To prevent nausea, you're going to tell the patient, don't eat a large meal at least for 4 hours prior to the test. Tell them to wear comfortable, loose clothing and good walking shoes. And they're to take their routine meds unless, and this is key, unless the doctor specifically instructs them not to take their morning meds. Otherwise, you do not want to tell patients, you have to specify that when you tell them about not eating or drinking anything at least 4 hours prior to the test, because some patients take their morning meds. They may take them at like 4 in the morning or something like that. And so if their test is not until 8 or 9 o'clock or something, you don't want, when you say don't eat or drink anything, they may assume that that means their morning medicines as well. So you want to make sure that you specify that they are only to not take their medicine if the doctor said so, and to avoid any caffeinated beverages. So how's the stress test done? You're going to get a resting EKG before all stress tests, because they have to have something to base it on, okay? Then you're going to get a baseline vital signs with the patient lying down as well as standing. You're going to need their heart rate, blood pressure, and respiration. The EKG may be done with the patient hyperventilating or breathing rapidly so that they can see if that patient has any ST segment changes or T-wave changes. And then the patient will then exercise either on a treadmill, bicycle, or arm bicycle while that continuous EKG is going, okay? The target heart rate, the stress test is continued until at least 85% of the target heart rate is achieved or the patient develops EKG changes or symptoms that requires you to terminate the test. And the target heart rate is calculated by taking 220 minus the patient's age. For example, a 60-year-old patient would have a target heart rate of 220 minus 60, so their target rate would be 160. For pharmacologic stress testing, this is done for those patients who can't handle the physical exercise part of the stress test. And it does not involve exercise. Uh, Patients who have amputations or your elderly patients who cannot exercise enough to get their heart rate up to that target rate will most likely have the pharmacological stress test. So this patient will have an IV line started, and they will be given IV dose medications that causes their heart rate to climb to that target rate. They're also going to be hooked up to that continuous running EKG with their vital signs being checked, and you're going to always be checking them for any symptoms. And then some of the common medications that's used for this is your dobutamine, daritamol, or adenosine. Your commonly used protocols for the treadmill stress test is your Bruce protocol, and this is the most commonly used for maximum testing. This is the treadmill speed and incline is increased for that patient every 3 minutes up to a total of 21 minutes. And then there's two other exercise protocols. You have the modified Bruce, which is less strenuous, and it's the incline and stuff is increased in smaller increments, and it's good for those patients who can't tolerate the Bruce protocol. Then you have your Naughton, which is a slower moving submaximal test in which the testing settings are changed every 2 minutes. And this test is usually used for patients who have been recently discharged from the hospital with an MI. So remember back when a few slides ago, we talked about the absolute patients that could not get an stress test. And although it was MI patients, the timing was different, okay? That patient that can absolutely not get a stress test are those who had a recent MI. And however, the doctors do tend to order this particular stress test for patients who've had an MI and who've been hospitalized, received adequate treatment and rehab, and they're getting them back up to par, okay? And okay, here's another joke of the day. My doctor asked me if I had ever had a stress test, and I replied, yes, it's called life. I'm sure we can all relate to that. Again, when was your last stress test? Well, I went to work yesterday. And of course, in y'all's case, you showed up for school, right? Okay, so that's all I have for you guys today. Your assignment is going to be to complete your chapter checkup on page 396. And don't stress, you got this, you guys. And I will see you next lecture. Goodbye.